of you who are joining this talk. My name is Doug Briggy. I'm professor and chair of the Department of Public Health Sciences at UConn Health. And I've known Christina a long time. I recommended her for this talk, so I'm just going to give a very brief introduction to explain that connection. Christina did her thesis, her PhD thesis, on the first large NIH-funded highway pollution study that I directed. Christina was reminding me, because she could mark it with her daughter's birth, that it was in 2008. I thought it was 2009. And Christina was at Harvard. I was at Tufts, so that might be a little unusual for you to think of. But the reason that happened is her mentor at Harvard, Jack Spengler, with whom I had worked previously, had been added to our revised application because at that time I was viewed as a new investigator at NIH, and there were questions by the reviewers as to, I don't know if you know all this, Christina, there were questions by the reviewers as to whether I could handle an R01 by myself. So we added Jack, put a subcontract in, and he used that, I think, mostly to fund your thesis work and to bring you into this project, which was great. And Christina joined the project along with two other PhD students. And at some point, I developed a fear because I realized we had invited three PhD students, Christina, one of them, into a community-based participatory research study about ultrafine particles, which were a form of air pollution that most air pollution researchers run like the wind to get away from because they're so hard to study. And I was a little worried about what were we doing to these three students. But as you can see, Christina here is a tenured professor at the University of Georgia. Her other colleagues, Kevin Lane is a tenured professor at Boston University, and Allison Patton is a research scientist at the Health Effects Institute, one of the leading air pollution research institutes. So it's a pleasure to see you again, Christina, and to have you give your talk. I would note, we've been able to collaborate along the way. We co-edited, I think, the first book dedicated to combustion-related ultrafine particles in health. So I look forward to your talk. Welcome to UConn virtually, and please take it over.
Thank you. So it's time for me to share. So let me go ahead and do that. Okay. So you can see things properly? Okay, thanks, Doug. So I'm very pleased to be here today. Thank you so much for the invitation. I am, an air pollution research scientist. I look at both exposures and health outcomes, and also interventions to reduce air pollution exposures. So today, what I'm going to talk about is a natural solution to disparities in air pollution exposures. So to get us started, all right, I want you to reflect, everyone that's on the call right now, about the basic survival needs that we have as a species. So we have our needs here of food, water, and air. And there's a daily amount that we need and a maximum amount of time that we can go without those. So think to yourself what you think it would be for food. And again, of course, this is average over everyone. And let's see what comes up. So on average, 3 pounds a day of food. We can go without food for 5 weeks, technically speaking. So that's a pretty good amount and for a long time. Next, water. So water, 5 pounds a day, so more than food. Maximum deprivation is only 5 days. So what do you think air would be? Well, you're probably thinking that it's at the bottom of this list, so it might be a little bit more, and you would be correct with that. So we use about 50 pounds of air per day, and we can only go without air for around 5 minutes. So this really shows the importance of air to our viability of us staying alive and the importance of the quality of that air as well. So there are many sources of air pollution in both the outdoor and indoor environments. In the indoor environment, we have some concerns such as mold, dust mites, and dander, as well as pesticide exposures that can also linger for a long time without breaking down indoors. Also concerns about nitrogen dioxide from stoves, volatile chemicals from cleaners, as well as combustion byproducts from cooking. So although these are very important, I'm going to hone in on those outdoor sources. And I'm generally going to talk about the first two are industry and traffic with representations here. So chemicals and particulates are emitted from industry, manufacturing, and electricity generation. Trains that carry, so these chemicals also come from exhaust when burning diesel or gasoline. Also, we're thinking about trains as well that carry freight and are also powered by diesel engines as well. There are insecticides and herbicides that are sprayed on crops, and a certain amount of that travels into surrounding areas. And a legacy pollution also providing exposures of leaded gasoline and lead that is still present in lots of areas and can be resuspended with dust. So in addition to man-made sources, there are also emissions of air pollutions through environmental processes. So wildfires are a natural phenomenon and are also increasing in frequency and intensity fueled by drought, as well as past forest management practices. Dust storms occur throughout the world and also transport large dust particles and other pollutants with it. And this happens locally in areas across our country, as well as dust storms in other parts of the world, even in like the Sahara Desert, and that dust being able to travel all the way across here, as well as from Asia, can reach all the way over to the United States. So adding in here some of those additional outdoor exposures, dust, pollen, mold, and mentioning also black carbon, which is released from any kind of combustion, including those wildfires. So we're concerned about these air pollutants because of the associated health effects. And there have been shown in many studies about impacts on the respiratory system, in particular, different symptoms such as coughing and wheezing, also the development of asthma in children, and even diseases such as lung cancer. Those have all been linked to exposures to air pollutants. In the cardiovascular system, which is one of the leading causes of death in the United States, there have been linkages with systemic inflammation, with heart rate abnormalities, atherosclerosis, hardening of the arteries, and also heart attack or myocardial infarction. Additional studies have examined the impact of air pollution exposures on the brain and the nervous system and have found some associations with stroke. And also there has been increasing studies finding linkages with Alzheimer's disease. There have been connections identified between exposure to pollution as well and reproductive outcomes, including low birth weight and also preterm births. So a large number of outcomes that have been linked to air pollution exposures. In addition, a main part of this talk is to discuss how air pollution is not distributed equally and that there's some patterns in high versus low exposure areas. I have this picture here to illustrate that many times there are vulnerable populations and they can be very close to the sources. So there's a refinery here in the background, and in the foreground, you see there's a playground where you have vulnerable children playing. The trend in many parts of the world, especially developing countries, has been increasing pollution over time as industrialization takes place and increases in those countries. So I have here a picture that was in the New York Times. This one is like a historical picture. It's kind of an undetermined year, but you can see how it's very clear. You can see the India Gate there. And then the same place in 2018 and showing the smog that was present in New Delhi at that time. So very drastic differences over time in many countries. So we can also look across them. This is specifically looking at concentrations of fine particulate matter. So those is solid or liquid droplets suspended in air. And they are very, very small, less than 2.5 microns in diameter, much smaller than a human hair, and cannot be seen that clearly. So this map from the World Health Organization shows the annual average PM2.5 concentrations for countries across the globe. And what is evident is that worldwide PM2.5 levels are higher for countries in the global south, especially in East and Southeast Asia, Africa, and the Middle East. And when you look here at the levels, the lowest levels are less than 10 micrograms per meter cubed. We have a current EPA standard of 9 for PM2.5, and they go up from there. And this darkest color here is between 35 all the way up to 100 micrograms per meter cubed average over the year. So very high concentrations. So air pollution is one of the highest cause of mortality worldwide. And this is another figure that shows what it is for several different countries. So specifically looking out at them, I'm looking at Nigeria, a mean of 64 micrograms per meter cubed, and again, PM2.5 and 51,000 deaths. You have here China, 49.8 with 1.3 million deaths. India with one of the highest here, 80 with 867,000 deaths. So these are very high concentrations and a significant number of deaths, over 4.2 million deaths from PM2.5 exposures and 103.1 million dailies as well. So we're going to focus in on the United States here, because when you look at this, you're thinking, okay, well, the United States is one of the lower ones here in terms of the concentrations and deaths, but we can go a little bit deeper into that. So I looked up just yesterday an article that was, a little closer to home for you guys, because I'm down here in Georgia, and came up with this story talking about how Fairfield County's air quality is poor when looking at comparing with some other areas. So high air pollution across Stanford and Fairfield County. And it goes on to talk about how that has resulted in health challenges for communities there. And you can tell the smoggy conditions here and also some of the sources right there. So overall, air quality, we're using PM 2.5 as the indicator, has been improving over time. So that means reducing over time, overall, on average in the United States. But when you look in more detail, especially within urban areas and looking at traffic sources, you will see that there are hotspots within cities that are much higher concentrations. Here, the lowest concentrations are in green, and over here, it goes up in terms of red. And you can see how the red borders some of the major highways here in the city of Atlanta going north and south, and also going east and west. And there's lots of homes and businesses and schools in these high exposure areas. So what we're talking about is traffic related air pollution. And I've listed here some of the main pollutants that arise from traffic exhausts. And some are primary, meaning that they come right out of the tailpipe. Those include particulate matter, especially the ultrafine particles that Doug was speaking about at the beginning in the introduction, along with sulfur oxides, carbon monoxide, and carbon dioxide, nitric oxide and nitrogen dioxide, and volatile organic chemicals as well, things like benzene, and also ozone, which is a secondary pollutant, which is formed in the atmosphere with these precursor pollutants. So we can spread out this picture a little bit more. There are other factors that can explain exposure and how it may differ between areas and between populations. So it has also been identified that, so this is broken down by race, and you can see that white population here is in the middle, and you can see that there are increases in PM 2.5 specifically for racial and ethnic minorities, as you can see from the orange line, the blue line, and the green line, and then also population here, Native American, being a bit lower. So not everyone's at the same level of exposures, and there are reasons for that. It's also been identified that lower income communities are more highly exposed than wealthier areas as well. So how can demographic factors be linked to higher or lower concentrations? So it can be things such as redlining. So there have been a couple of studies looking at the impact, the current impact of redlining, and those were maps that were drawn in the 1930s. And it was a process instituted by the federal government to color code residential maps for investment purposes. And communities that were predominantly white were colored green, and they were targeted for investments and different community assets, while communities that were Black were lined in red and were specifically blocked from specific housing and business loans and other community investments and amenities like parks and services. And then there were two gradations in between those extremes. So in these studies, they found that red line areas had significantly higher air pollution compared to those that were outlined in green. So some of the reasons for that is that due to redlining, a concentration of energy in low income areas and also in Black and other communities of color. And those are sources for pollution exposures. Also, the price of land as well in areas that did not have much investment. Therefore, the prices were cheaper and easier for companies, including industries, to come in to those neighborhoods. Zoning as well of placing different residential areas close to industrial areas. That is also a reason. And other aspects of urban design that was done in different parts of the countries. And I'm going to highlight a specific person that was very important into the development of cities. And his name was Robert Moses. And he was definitely in the forefront from what has been called urban renewal. And that has been changing the landscape of cities, and how that example from what he did in New York City, he was appointed to multiple offices and held multiple offices at a single time, but he was never elected to any public office. But he was very instrumental in parks and also transportation in New York City and reaching out into the surrounding areas. So some of the things that he did is that he demolished minority and white working class areas to build highways and bridges, including the Triborough Bridge, the Verrazano Bridge, and Queens Midtown Tunnel, the Cross Bronx Expressway, and also the West Side Highway. Those are just some of them. He deliberately excluded Blacks and Latinos from parklands and recreational areas by making them only accessible to cars and not to buses, and really changed a lot of the cultural fabric from a lot of different communities through increased environmental exposures for poor, for immigrants, and for people of color. So what he did in New York City was taken on and replicated in most major cities in the United States that were trying to increase and like industrialize along the same way as was done in New York City. So a lot of structural changes in place that are bearing itself out. And also here, created many beautiful parks as well, but they were in areas that were in wealthy areas. So as a result of these structural changes that took place over time with the changing of our cities and also suburban areas, there are communities that are located close to traffic sources and the pollution that they bring. So those are existing and very difficult to change. So researchers are exploring novel methods to reduce population exposures to traffic-related air pollution. And there is a good amount of evidence of the ecosystem benefits of trees in urban areas. They're able to reduce impacts of the urban heat island effect, as well as help with wastewater runoff. Green areas are also linked to positive mental and physical health outcomes, such as lowering depressive symptoms and improving recovery times after surgery. In addition, the scientific evidence is building that the volume of tree canopy in a city or region affects overall air quality in a positive way. And when we are specifically looking at the near roadway environment, there can be so many different arrangements of trees in that space. So I have here a picture in the top left about there's some vegetation that's here in the median of a busy road. Up here on the right, you see that there are very large trees next to the roadway. And small bushes as well are something around this particular house next to the roadway. And we also have large trees as well, which are many times planted next to roads for beautification purposes. And even here, you could have the canopy really crossing over the roadway in this case. So with all of these arrangements, how are we going to figure out what can be beneficial and what can be a tool to reduce air pollution exposures? So what I'm going to continue talking about is up here in this top corner. So there are options to reduce near roadway exposures down here, putting tunnels instead of having surface roads. You can have sound barriers as well that may reduce pollution, or you can have setbacks of a certain space so that the pollution can does reduce over space due to dispersion. And here we have trees and bushes. How can they be beneficial? So what we know thus far is the goal of reducing the movement of particulate pollution. Existing evidence does provide some general guidelines that separate efficient from ineffective vegetative barriers. So this document lays out some of the knowledge on green barriers for near roadway pollution reduction. So on the left-hand side are descriptions, pictures of what an efficient barrier would look like. An efficient barrier is going to act like a filter. It's going to disperse air pollution and but not be as solid as a wall that it would come over, but it's really going to act as a filter. So this can take place with very large trees, and evergreen trees are also good because they're going to be green throughout the year. But you also have some circumstances where it may be low bushes as well. These go up, probably looks like about 8 to 9 to 10 feet, and they possibly can serve as an efficient barrier as well. What is very clear about these being ineffective is that shade trees that have the trunks down here showing is going to be an avenue for the pollution to just be transported underneath the foliage. And also, if you have trees that are too widely sparse and spaced out, then that's not going to serve as a barrier. So overall, efficient is going to serve as a filter, have a large foliage, and also have foliage that goes all the way from top to bottom. But how much reduction is possible? Again, there's so many options. And in what places are they going to be most functional? So I've done work with a few studies of looking at this particular questions. So measuring the differences in particulate matter next to tree barrier sites, combination sites which have a tree and a sound barrier, and also sites that do not have barriers. So what we did at this in this series of sites is that we measure continuous concentrations of particulate matter, black carbon, and we also collected particulate matter on filters to calculate their mass. We used particle number concentration as a proximate measure for ultrafine particles because the smallest particles dominate the number count in urban areas. And we also examine local meteorology as well, because when you have roadways, where the wind is blowing and how strong really makes a difference to concentrations. Right here, we have the combination barrier sites. Then we have one site here and another that did not have any barrier, just a chain link fence. And then we had two that had some vegetation in front. So some of the statistics is that we chose the major roadways in the Atlanta area, the different barrier types, and knowing what the direction in terms of the wind direction. And these were the number of cars and trucks that were passing, up to 20,000 cars per hour. So very heavily trafficked for some of the sites. And we also qualitatively describe the vegetation density. So what we show here are some summary statistics, and this is looking at particle number concentration on the left-hand side and black carbon on the right-hand side. So what you can see here on the left-hand side, that even under these conditions, calm wind speeds, when winds were blowing towards the highway, parallel to the highway here, or from the highway, that you don't have very different concentrations here for particle number concentrations. We would expect it to be highest when winds are blowing from the highway through the vegetative barrier and to where we have our sensors set up to measure concentrations. For black carbon, though, you do see that there are reductions in these medians here for wind parallel to the highway is the most, and also wind directly from the highway as well. So we use generalized linear mixed effects models to estimate the effect of the barrier type on the ratio of particle concentrations at the comparison site relative to our roadside site. And we controlled for different covariates that were important. We controlled for the wind direction, for temperature, humidity, traffic volume, and also the distance to the roadway. And our vegetative barrier sites exhibited the greatest reduction in the traffic-related air pollution in terms of black carbon. And you can see that highlighted here, of 37% lower behind the vegetative barriers. And that was statistically significant. And there was a very slight, non-significant reduction of 5.2% lower for the particle number concentrations. And we looked at some sensitivity analysis looking at when the sites were downwind of the highway and found a little bit more greater reductions. In a prior study also, we looked at seasonal variation because, as I said, in many places you have deciduous trees that are going to lose their leaves in the wintertime, but may also be a mix with evergreens. And that's what the mix is like down in the Southeast, of having deciduous and also evergreen trees and pine trees as well, mixed together. And so we evaluated at a particular site close to a school, meaning that's one of our vulnerable populations of concern, are students. So what we found here was, again, consistent decrease from black carbon with distance from the roadway. And we also found that this decrease was steepest in the winter, followed by spring and then summer. So there are some variation depending on the tree foliage that you have, which changes the gradient. So some conclusions that we have is that in the study of the multiple sites, we identified reductions in black carbon associated with the presence of a vegetative barrier. But we did not observe a reduction in ultrafine particles. And this is along the lines of what some other studies have found as well. This infographic here shows a meta-analysis of some prior studies that were finding on average a 52% reduction in black carbon and particle number concentration reduction around 30%. And then some reductions additionally when you're looking at specific size fractions, but mostly for black carbon and particle number concentrations. But we didn't see the ultrafine particles reductions in our study, but black carbon was very strong and statistically significant. So there still is some knowledge gaps to look more into. So lack of information from some regions. A lot of this work thus far has been done in the Southeast. Also, how is there an impact of vegetation growth over time? What is that going to do for the actual foliage that's available? And how, especially for one of the projects that I worked on, they had as part of it was to plant trees. So how long is going to take to have a benefit from those trees that were planted? That's something that hasn't been researched yet. Also, we need more estimation of what a sufficient width and thickness is for the tree barriers. There is quite a large variation of just looking at a single line of trees versus looking at up to 30 meters thick and seeing what's going to be the most efficient in reductions. And also the possibility for adverse impacts. If anyone has been or is from the Southeast and from Georgia, their pollen can be really, really high, especially in the springtime during the particular 2-week season. And so that can be a drawback to having certain tree species. And also, trees do release a certain volatile biogenic chemicals as well. And how much does that factor into the mix? And how does that compare to that which is being created from the cars and trucks on the road? So I think it's also important to mention that as with looking at disparities, we also have to look at potential benefits of having a vegetative barrier or some other intervention so that communities are treated equitably. So air pollution disparities continue to be an issue that affects many low income and communities of color. So vegetative barriers, which are a type of green infrastructure, is that potential intervention that can reduce current exposures. So in order to reduce exposures where it's most needed, we really have to target those communities that are most highly affected. And they can be first in line for green infrastructure projects. Also, community inclusion should be at the center of these types of green infrastructure and vegetative barrier development. Many times they're concerned about having not being able to see roadways or not being able to see property if you have this type of tree barrier. So really trying to figure out if there can be ways of putting other types of maybe clear paneling in some areas, or maybe having looking at lowering or having something higher depending. So just trying to figure out what it would look like specifically in certain areas that will be a holistic infrastructure plan and can serve multiple purposes as well. So that is actually my last slide. And again, This is an exploratory, area of research that I hope grows over time. Unintended with that, I suppose. And it really does warrant new and expanded research, I feel. So I'm going to leave you with this and to thank you all for your attention. Thank you.
Thank you. I'm not sure what my role is at this point, Christina. I was the introduction, but I think you can, someone is supposed to open up so that attendees could ask questions, I think. Josh, are you doing that?
So people will be able to unmute themselves in a moment and ask questions. Doug, if you wouldn't mind just monitoring the chat and relaying anything that goes into the chat to Christina, that would be helpful. Thank you.
Okay, I'll do my best. And Christina, you can handle people speaking up for themselves.
Sure.
There's a question in the chat. Who is responsible for developing these barriers? Is it the federal or local governments? I know we had not such great experiences in Massachusetts with that issue, but I have no idea in Georgia or elsewhere. So go ahead.
Yeah, that's a great question. So vegetative barriers can be put on public land, on private land. So it has been a lot of leadership in the areas of municipalities that have decided to put, next to the right of way of highways and some of the busiest roadways to place trees, and also maintain trees that are there as well. But also when there is development of new, especially new multifamily housing, I've also seen that developers are also able to take leadership as well and either maintain tree barriers when they're building or updating properties, or to establish new barriers as well. So it can be in private or public realm.
Hi, Christina. This is Trisha Lee, Director of InCHIP. Thank you so much for joining us today. It's a real pleasure, and I thoroughly enjoyed your talk. I have a question that might be quite basic, but I'm a clinical health psychologist by training, and this is definitely not my area of research, but I'm curious. It sounds like these fine particles are really difficult to try to contain, and I'm just wondering, is there anything that tends to help to soak up the fine particles and keep them, within the areas that we want to keep them and away from communities that you're aware of?
Yeah. So we have different types of particles, and we study them based on size, and also they have kind of some differing health impacts based on size as well. The smaller particles get down lower into the respiratory system, the ultrafine particles, versus some of the larger particles are removed up in the upper airways. So in order to reduce the outdoor concentrations, we have EPA regulations per the Clean Air Act, and that is to reduce the sources of pollution from industry in terms of regulations on permits for how much pollution that they can release. Also for cars as well. When you get your cars in many states, you have to get it checked out every year if you're adhering to those standards. And so that's also ways of reducing the outdoor concentrations. There's also impacts on the indoor environment. So when I was doing the study that was at the school, if you're in the outdoor environment, you're exposed to those chemicals and those pollution. And in the indoor environment, there are also filtration that you can utilize that can reduce the movement of pollution outdoors into the indoor environments where children are going to school, where, hospitals, have sick patients and things like that. Does that answer your question?
Yes, it does. Thank you.
Okay, great.
I see two hands up. I don't know. I think Debs, you were first. Debs, I don't know if we've ever met. You and I share a connection through Alex Hogan, but anyway, go ahead.
I think we only met virtually, so we have to make it a point to meet in person. Thanks, Dr. Fuller. That was a great talk. My name is Debs Koch. I'm a professor in the Department of Geography, Sustainability, Community and Urban Studies. I'm a health geographer in training, and this topic, among many others, are very close to our discipline. I was wondering, once you have the results that some part of green barrier, a kind of green tree barriers is working better than the others, and you prioritized that some of the vulnerable communities or communities of low income or racial minority communities should be prioritized higher than the other areas, I was wondering, in terms of dissemination or community engagement, how one researcher would go about that? What would be your pitch to the community or people who can make social changes like this, that I would want this in this area over the other?
Yeah, that's a really good question, and something that is always difficult because they don't train us in, we're trained to do research, but not to really get our research out to some of the people who really need it. But I do a lot of work with community-based organizations. And so doing a research in relevant locations and then sharing that information with them, and they have a lot of contacts with elected officials in the city and municipalities to be able to translate and advocate for perhaps having green barriers put in their communities. And also going out and doing that a bit myself with some nonprofits like here in Atlanta, and actually most cities, they have some kind of a tree ordinance that they utilize to, looking at the maintenance of trees in different municipalities. And so working with groups that are working on those types of municipal documents, providing them with information and knowledge about my studies. I talk with people that were instrumental in that. So there are no green infrastructure, anything concrete in like the most recent ordinance, but it's definitely possible in the future with talking more and more with my research with people in cities and also nonprofits and communities.
Mm-hmm. Thank you.
You're welcome.
Misty is, Christina, Misty is the assistant professor in the department that I chair. Go ahead, Misty.
Yeah, definitely have air pollution is kind of my thing. So a lot of questions, but I was just going to ask more from the city's response to this. Are there ever any concerns about the trees themselves, having to maintain them? Is this going to kill the trees? Are we going to have to replace them a certain amount of time? How does that discussion come up?
Yeah. So I've had a few of those discussions. There is some concern about the cost of maintaining trees, and also about safety as well, with regards to having trees. Many people, like I said, are concerned about, if you're not able to see in certain areas, which is a very real concern in lots of neighborhoods. So I guess it has been a little bit limited thus far. I've just been talking to them about some of the benefits, but cost for maintenance has been something that's come up a couple of times.
Okay, I was just interested to know, sometimes.
And also another thing that comes up as well is, you have your transportation departments, and putting things in the right of way can also be very challenging because they're maintaining the right of way for a certain purpose. and for safety on the road. And we're
Right.
talking about doing something a little bit different. And so that's definitely more conversations I'll be having in the future, because you have to talk with multiple agencies and departments.
There's a city in Texas called the Woodlands, which they're very proud of their trees, and they have a lot of trees on the side of the roads, which is kind of interesting. I grew up in that part of area for part of my life, and I remember talking to somebody about having to replace the trees closer to the road more often than further away, and I was like, I mean, that kind of makes sense to me, just even from but it was just a discussion, it wasn't like they were like, oh, I have to do this, it was, so I was just interested enough if that kind of come up here. But there are trees all along the road, so intentionally, and if you knock out a tree, you have to replace it. That's one of the ordinances, and so you can't see a shopping center, but that's fine, I think. I mean, the trees are nice.
Yeah. And they do have a benefit. Well, they can have a benefit. It's very much looking locally at what some of the local conditions are is really important to see, because if you have trees that are along roadways that are in cities that have like a street canyon where you have high buildings on both sides, and then you have trees there that actually kind of stagnates the air in that area and can get pollution to kind of build up. So, but it's very different if it's on the roadside and you have some distance there, then it can be a reduction.
That makes sense. As a separate comment, I'll just share, or maybe it's partial question, partial comment. We had a study where we looked at traffic-related air pollutants, and we asked them about their perception of exposures, and we compared their how often they were exposed to traffic compared to what our data showed. And it was interesting. We knew where they lived, and so we'd asked about at home, we asked about at work. And individuals who had trees blocking their view of the highway, even if they were literally back to back, they reported a much lower perception of exposures. I thought that was kind of interesting.
It is very interesting. Yeah.
A great talk. Thank you.
And Misty's postdoc, Abe, has put a question in the chat. Two questions, actually. First, why was there not much reduction in PNC unlike black carbon? That was my question, actually. Also, so I'm glad he asked that. And then I think he's offering a possible suggestion. Were there more contributions from background regional air pollution sources for PNCs versus black carbon?
Yeah. So it was difficult for us to be able to test specifically where, if there were background levels of air pollution for those particle numbers. But we do think that we did not see a reduction because of other sources that were coming from the side where we were monitoring that were increasing concentrations on that side. So we couldn't really evaluate if there was a reduction. But for black carbon, that's very much tied to some of the diesel vehicles that we knew were on the road. That's why we think we were able to see a reduction that way, because that was the major source. But for the ultrafine particles, there were other sources around that could be generating those concentrations. You're muted, Doug.
I complain when other people do that. Somebody, I think, raised their hand, but maybe they lowered it. Oh, no, I see it. Olivia, I don't know you, but Olivia, please go ahead.
Hello, Prof. Thank you very much for the presentation. And I like the fact that you also mentioned the areas that you'll be looking at into in the future so far as this research is concerned. So in the Department of Geography here at UConn, and my research focuses on health, and I also, as part of health, I also look into the psychosocial impact of health. So I would want to know that You mentioned some areas that you'd want to look into the future, and you also mentioned that you are working with other people in collaborating with people so far as this research is concerned. So I want to know that, do you have plans considering, either than the physical impact of this air pollution on the people, do you have any future plans to consider the mental health or the mental impact on these people as well? Thank you.
Yeah. So one thing that I'm definitely interested in and we'll be exploring are looking at perceptions, kind of what Misty was talking about, perceptions of pollution, but also perceptions of the vegetation, and seeing how those associations are being carried out. And I'm going to be looking at also respiratory outcomes and like cardiovascular outcomes too. Definitely mental health is one of interest, but I'm not planning on doing any of that research right now. But definitely the cardiovascular disease and the respiratory diseases. But looking at mental health outcomes is very interesting because they've done studies that have looked at the mental health benefits of being in a green environment or taking walks in the forest, and found benefits to mental health for that. So be able to combine that with, does it modify any, reduction in pollution, to also look at the mental health outcomes? It's also very interesting.
Maybe we have time for this one last question in the chat, and then I think we're reaching our limit. Jennifer Williams writes, someone mentioned earlier that trees closer to the road need to be replaced more often than those further away. Has any research been done on this issue and how it might affect a program of installing and maintaining vegetative barriers?
I'm not familiar with any research about the replacement of trees closer to road. I just know from doing the research that I've done that a lot of those decisions are made just for safety and transportation by the Department of Transportation or the State Department of Transportation, and even getting rid of barriers also from a safety perspective. There was one particular site where we were looking at, a combination barrier of a sound barrier with vegetation. And in our first year of research, the vegetation was there. And the second year, when we came back to do our repeated measurements, the trees had been cut down. So I was totally like, oh no, they cut down the trees, So we weren't able to evaluate it in the second year, but we were able to evaluate in the first. And that was definitely just based on transportation decision. Yeah.
Okay, but
so I think Tricia, we should wrap up the formal program now. Yeah, I see you nodding. So I don't know what you do, if you allow people to stay on for a little while, if anyone wants to. I just want to close it by thanking you, Christina. That was a very nice presentation. I particularly like how graphically clear and how easy to follow it was. That's really wonderful, and I'm proud to now have you as a colleague instead of a student. So anyway,
Thank you.
And then I guess, Tricia, if you don't mind, if there are some people who want to hang